Hi, Stuart.
Hi, Marianne. Good to see you.
Good. How are you? How's your son?
Zach is doing great.
Good.
You know, we've gone on more walks the last few months than ever before. Um, he's becoming a real hiker.
Nice. It's a good thing. It's free. It's good for your body. It's good social.
Yes,
All kinds of wins.
forest bathing. Yes.
Hunter is so big,
Yeah.
it's hard for him to walk a long distance, to carry that body.
How tall is he, Marianne?
6'7".
Oh
Wow.
my gosh. Wow.
Big, yeah, 300 pounds.
Wow.
Big guy.
That's
And I've got, I've allowed myself to get used to that because I was always, he's got to lose weight. He's got to lose weight. I mean, it gets crazy. So we work as hard as we can to manage the food. But, Tom Fraser has a kid too, that just all the cabinets are locked. The food, we have separate refrigerators. I mean, it's like his one thing.
Yeah.
Anyway, I don't mean to take up as we're going into advocacy.
No, this is our warm-up conversation as we get ready to welcome everyone to our webinar.
Yeah.
We'll give it just another minute, Heidi.
Okay.
Okay.
Started.
Sounds good.
So I just one thing I wanted to mention that I'm going to hit up Judith and Stuart to be part of a work group for the job seekers who need more support, intensive support.
Oh,
Good. Josh, myself, and if there are other people you think need to be part of that group, that would be great. It's not, it's not going to be forever. We're going to have like 5 sessions. Get the content down for what we want to be presenting in the employment ecosystem. So that'll be cool.
Excellent.
Yeah.
All right. Well, I think, Heidi, if you want to go ahead and get started, we can go ahead.
All right, perfect. I just want to thank everybody for joining us today for our Arizona advocacy update with Judith and her team. It's really important that we all hear the same thing. And my name's Heidi Naranjo. I am the director for the market here in Arizona and been with Autism Speaks for over 15 years, not in this role necessarily, but with Autism Speaks. And we're just thrilled that you're on the phone with us today and Skype or Zoom. So thank you guys again for joining us. And then I will turn it over to Judith.
Thank you so much. Hello, everyone. I'm Judith Ursetti. I'm Director of State Government Affairs at Autism Speaks. And I know many of you, and I'm so grateful that you're taking time today to engage in advocacy. It's such a trying time for our community. And we want to make sure that our Arizona community knows what's going on the federal level related to autism advocacy and COVID-19. And also we want to bring to your attention some issues that are going on the state level. So thank you for taking time to join us today. Many of you are familiar with Autism Speaks mission, which has evolved over the years. And it's evolved because we understand that our community is, I think it's more than a spectrum, it's a constellation. There's darkness, there's light, there are challenges, there are gifts. And Autism Speaks is really working to try to support our community, to accelerate acceptance for our community, to create opportunities, and to also provide meaningful research into supports and services that can really make a difference for those who are struggling with challenges related to autism. So it's a really broad mission that we hope engages the entire autism community. We try to do this through global understanding and acceptance of people with autism. I always tell people that if you really think that acceptance and awareness is done, please just come with me to a state capitol and talk to some state legislators. And you'll realize that we have a lot of work to do still to provide awareness about that constellation that's the autism spectrum. We do want to continue to work on life-enhancing research so the things that are hard about autism can be addressed in a meaningful evidence-based way. We'd like to see early childhood screening and timely interventions nationwide and all around the globe. We're concerned about transition to adulthood. I'm living that right now. I have a 16, almost 17-year-old who has autism spectrum disorder and a severe intellectual disability. He also has a future, and I care about it, he cares about it, and so we want to make sure no matter where people land on the spectrum that they do have meaningful opportunities to transition into adulthood. And we also want to make sure that our community has access to reliable information and services throughout their lifespan. You don't age out of autism spectrum disorder, and we want to make sure that you have good information that's supporting you wherever you are. Here's all the legal stuff. So just know that, you know, we're not giving you legal advice today or medical advice. We just want to talk to you about advocacy and supports and services in your community. We've talked a little bit already about the challenges around autism. During the time of COVID-19, those challenges have truly been exacerbated. This issue really kind of came upon us unexpectedly, and it's caused really abrupt discontinuation of the educational services that many of our community access. Day programs are closed or limited, as are clinics. We've had this shift to telehealth even more than has been available in the past. We mentioned here mental health supports for parents. I would say also for siblings, for people who have autism spectrum disorder, for the whole community. I know I've been accessing mental health supports during this time once a week, and I'm proud to say that. I need that as an autism mom, and I encourage you, if you need help, to talk with someone too. Lack of connection to community opportunities and supports. And thinking about that, I always go back to my personal experience. Every Saturday for the last more than a decade, usually around 3 o'clock, my son Jack asks for wings. And what he means is that he wants to go get wings at Outback Steakhouse. And so we've been going to the same Outback Steakhouse for many, many years. And Jack is connected to the staff. They're connected to him. When we walk in, they know what his order is. This is part of his community. And right now, even though we can drive through and pick up some wings, he's not seeing that wait staff and the people who mean so much to him in his community. And it may seem like a small, trivial example, but for him, it's everything. And he just continues to ask. So those disruptions to community, to connection, are affecting people all across the spectrum. Respite is definitely something that's critical for our families. Autism can be a 24/7 situation. No parent or sibling or provider, you know, we all have limitations and we need help. I skipped over community employment. Forgive me for doing that. Employment, we were talking about it before the webinar began. It's important for people with autism, and many have worked for years to secure employment in the community, and now they can't access it. Much needed routines are disrupted. I know we were talking earlier today. I have a schedule that I use for Jack. Usually starts with breakfast, unload the dishwasher, listen to music, you know, go for a run. Maybe we're trying to create a schedule for him. I think I might add a previous schedule occupant, which would be maybe have a meltdown at the beginning of the day. But the traditional schedules, as school or community outings or things that people with autism do, those have been disrupted. Income. It's devastating to families to be struggling to pay to get food on the table, to make sure you have, you know, a roof over your head, just the basics, and then also access to healthcare and things like that. Challenging behaviors are very real all across the spectrum and for our community. And a lot of times it's something that people aren't comfortable discussing. And we don't want to say anything, you know, that's disrespectful or invades anyone's privacy. But we do want to acknowledge that challenging behaviors are real, they're hard. We hear about it, you know, when people call our autism response team. Self-injurious behaviors, aggressive behaviors, they can really spike during times like this. And we've been having a lot of conversations also on the national level, on the state level, about what it looks like right now if you need to access healthcare and you have autism. What if you have autism and COVID-19? Can your caregivers, can your family members be with you if you're hospitalized? Those are concerns that we've heard about from our community. And so that has really kind of informed the advocacy we're pursuing on the federal level and on the state level too. And I would just ask you to engage with us on that. If this list doesn't include a concern or a challenge that you're facing, please let us know. We have everyone muted because of the number of participants in the webinar, but we want to hear from you, so you can actually type your questions or comments in the chat box and we will respond. So please feel free to do that at any time. We will stop throughout the webinar to answer some questions. We probably won't get to all of them, but we'll answer the ones that we're able to. And we will be providing a recording of this webinar as well as a copy of the webinar to everyone after it's over, so stay tuned for that. The goal is to get good information to everyone during this challenging time. All right, and we're going to mention this, I think, more than once during the webinar, but it's so important. We talked about the challenges, but I really get annoyed when people talk about challenges or problems, but they don't present any kind of solution. So one solution that we want to make sure we're clear about today is just letting you know that we do have an autism response team. You can call them at 1-888-AUTISM-2. There's a number that you can access that provides information in Spanish, or if you prefer, you can email help@autismspeaks.org. So if you have a really individual kind of situation you need help with, if you don't get an answer today through the chat, please email help@autismspeaks.org or call us. We want to be there for you and provide information to you. Okay, and finally, I just quickly want to let you know what to expect from here. Heidi, thank you so much for the warm welcome. And we're going to turn it over to Dave in a moment, who's going to talk about what's going on in DC, which is always interesting day to day. I'm going to provide a brief primer on what we're looking at on the state level, and then we certainly want to make sure that you're aware of supports and services that are available to you right now during the time of COVID-19, and Mary Ann's going to talk with us about that. Okay. You have heard enough from me for now. So Dave, if you don't mind, I'm going to turn this over to you if you could give us that exciting DC update. Thank you, sir.
Thanks, Judith. It's great to be with you all today. As Judith mentioned, my name is Dave Zikovsky. I work on our Autism Speaks the federal side of our advocacy team, and I'm based out of our Washington, D.C. office. Well, in the office when we're actually able to, but in the D.C. area. So what I wanted to do is just bring you through briefly a high-level overview of what has happened in Washington since the onset of the COVID-19 pandemic, in terms of bills that have passed, specific items within those bills that impact the autism community, some of the priorities that we've been specifically advocating on, and then talk about what the path forward might look like here in Washington. In all of this, I know I'm going to leave out detail because a lot of these bills and other actions contain a lot of information, a lot of detail, and there may have been things that you've heard about that I don't cover that you have questions. So I would really encourage you to put those questions on any of these topics into the Q&A box, and we'll try to answer as many as we can, although hopefully I'll be able to get through a lot of information that will answer some of those questions. So let me just start back in early March. So March 6th was the first piece of legislation that passed in Congress to address the crisis. This was the Coronavirus Preparedness and Response Supplemental Appropriations Bill. And you'll notice here that we have the bills labeled as COVID-1, COVID-2, COVID-3. That's just the way in DC that these bills have been referred to, just in terms of the order in which they passed. And so that first bill on March 6th was really the first amount of money that was expended and or at least provided for the public health response to the crisis. It was just kind of an immediate action that was taken with recognition that there would need to be additional follow-up action taken by Congress. So several weeks after that, on March 18th, the Families First Coronavirus Response Act was signed into law. It's also known as COVID-2. In addition to providing some more funding for the public health response, dealt with some more individual specific and family specific provisions. So for example, that law created a temporary emergency paid sick and family leave policy for individuals working in employers that have less than 500 employees. And there's a lot of detail in terms of the specifics of that program that we'd be happy to share with you, but that was one of the major portions of that law. And then in addition to that, increased Medicaid funding, expansion of food assistance and unemployment benefits, and a number of other important provisions. So several weeks after that, the Coronavirus Aid, Relief, and Economic Security Act passed. The COVID-3 bill, the CARES Act, it's known by a bunch of different names, but you all have heard about this, I'm sure, in one way or another, because this was the really giant relief package that Congress passed. It was over $2 trillion in funding for a whole host of things. So the $1,200 per person stimulus checks, for example, were provided through this law. $500 for dependents under the age of 17. That's an issue we'll talk about a little more in a few minutes. The $600 per week increase in unemployment benefits was contained in this law. Hundreds of billions of dollars for the public health response, money to state and local governments specifically for their response to COVID-19. The Paycheck Protection Program, which is a program to assist small businesses to help retain employees and keep their businesses operating during this pandemic. That was funded at about $350 billion and was aimed at keeping people on their payrolls, and I'll talk about that one in a little further. Billions of dollars for schools. This is for higher ed, for elementary and secondary ed. There's about $13 billion, and then a set aside for governors as well to utilize to assist school districts that were facing particularly challenging circumstances, although I think every one of them is. And Judith will talk about this in a little more depth later on in terms of our advocacy around once those dollars get to the state and local level, what do we hope that they're doing with that money, and what are we doing to advocate in that space. And then lastly, the extension of the Money Follows the Person program through November was included. Judith, if you don't mind going to the next one, please. So basically from the moment the CARES Act passed on March 27th, there was a lot of discussion that there would need to be another large relief package passed in Congress. And from that time till now, really, and there's been a lot of negotiation discussion about what can happen. And so if you look here, I put on April 24th, COVID 3.5 passed. And the reason that it was labeled as such, as a 0.5, is because this was a very narrow measure. So while Congress has continued to try to find a way to provide additional relief, whether that's for individuals through additional stimulus type checks or a whole host of other provisions or addressing a whole host of other issues, they haven't come to an agreement yet on that. But what they did come to an agreement on April 24th was replenishing the Paycheck Protection Program. So this program had $350 billion and it ran out very quickly because of extremely high demand for small businesses to access basically forgivable loans, depending on how you utilize the money. And so this law really was limited to replenishing that fund and then also providing a fairly substantial amount of money for hospitals and for additional testing. Can you go to the next one, please? As I mentioned, we've been, even before the CARES Act passed and to this time now, we've been advocating with our federal champions and with members of Congress to bring to them the challenges that the autism community has been experiencing, and based on what we've heard from listening and from talking with individuals and families, bring to attention some priorities that we think are important for them to focus on in any future relief bill. So, for example, providing additional funding for home and community-based services, having additional funding to meet the educational needs of students with autism. This is both right now in terms of ensuring that to whatever extent there is distance learning, that there is as much money as needed to provide the best level of services and supports for students, whether that's through technology or otherwise. And then ensuring that when students return to school, that school districts are ready and have the resources to provide services that we know are going to be needed to address regression. Protecting the rights of students under the Individuals with Disabilities Education Act and other laws. This is something that throughout all of these various negotiations we've stayed very vigilant on. There was some discussion about a potential waiver of IDEA requirements, and we have been very concerned about those types of ideas because we don't want the hard-fought protections for our students to be rolled back, and that there are ways to ensure that they are receiving appropriate educational services without having to roll back this really important law and the protections of it. So we're heartened to see that no waivers were included in any of the laws that have passed. What was included was a report, a requirement that the Secretary of Education release a report indicating whether or not she felt a waiver of IDEA or any waivers of IDEA were necessary. And that report was issued in late April. Her report did not indicate that any of the core protections of IDEA required any waivers. And so, we continue to stay vigilant, as mentioned, on this, and understand that, just because that decision was made doesn't mean that all of the challenges for serving the educational needs of students on the autism spectrum are solved, and that there's a lot of work to do. But that's what this bullet point here was referencing. Expanded access to telehealth services for healthcare needs and ensuring that they're appropriate for individuals on the autism spectrum has continued to be a priority. Eligibility for the $500 economic impact payments for dependents over age 17. So as mentioned in the CARES law, there was a $500 payment made available to dependents under the age of 17, but not over. I can't tell you exactly why Congress drafted it that way. There was I think a lot of negotiation around it, but the bottom line is it leaves a lot of people out and a lot of people within our community out. And there's, I think, a real equity issue here. So we've been advocating to correct that, or that Congress correct that in any future package. There's a lot of momentum behind that. A member of the Congress in the House has introduced a bill that has, I think, over 150 co-sponsors on it now, and Senator Smith, Tina Smith in the Senate, has introduced a bill on that topic as well. So we're hopeful that that's something that could move forward. According caregivers of adults with disabilities, the same emergency paid sick and family medical leave policies according to caregivers of children. So as I mentioned, one of the laws that passed in March allowed for emergency paid sick and family medical leave. And in that law, it included a various number of eligibility or characteristics that would allow someone to be eligible. One of them was if you were a parent or caregiver of a child whose school is closed, or child care center, you could be eligible for the paid sick and family medical leave. What wasn't made clear in the law was whether or not the caregivers of adults with disabilities whose regular source of care or adult day center was closed would also be eligible. We advocated with the Department of Labor along with a number of other disability organizations, and fortunately the Department of Labor made the right decision and allowed eligibility to that group of individuals. And last but certainly not least, preventing discrimination in treatment decisions and care allocation based on disability. We've done a few things in this space. We've applauded the HHS Office of Civil Rights, who has put out guidance across the country telling healthcare providers that they shouldn't be making discriminatory decisions on who gets care based on disability. We've put out several statements, one related to ensuring that personal protective equipment is provided to centers where for individuals with disabilities and their caregivers. And then just I think 2 days ago, we put out a statement related to the issue of caregivers not being able to accompany individuals with disabilities during their hospital stays. This has been an issue where we've heard horror stories, and there's been horror stories across the board in terms of individuals not being able to see their loved ones during this crisis. But in particular for individuals with disabilities who may not have the ability to make some of these care decisions on their own, and not having a caregiver being able to accompany them is a really, really difficult and an awful situation. And so we put out a statement urging HHS, CMS, so HHS and the Center for Medicare and Medicaid Services, as well as state authorities, put out guidance indicating that caregivers should be allowed in during these hospital stays, and that we encourage hospitals as well to adopt these policies. So in terms of like all of these priorities, we've been advocating with members of Congress, and in particular the co-chairs of the Autism Caucus, Congressman Mike Doyle and Congressman Chris Smith, who are the co-chairs, and they've sent letters to congressional leadership advocating for many of these priorities. Go to the next slide, please. So what's next? So right now, as I mentioned, negotiations are ongoing. Just a few weeks ago, the House of Representatives passed a bill called the HEROES Act, which is a $3 trillion package that includes like $1 trillion for state and local governments, money for housing relief, other public health funds, additional individual and family economic relief. But what I'll say about that is essentially this was kind of an opening salvo in terms of here's the House's ideas for what should be in the next relief package passed by Congress, but the Senate has not indicated that they will take up this bill in the form that it's in. So there will have to be some additional negotiations before any final deal is reached. So with all that said, I do want to mention a few important priorities that were included in the HEROES Act that we hope are preserved during the course of negotiations. So a substantial increase in funding for home and community-based services during the crisis to help ensure that people who are on wait lists potentially can get access to them, that there's PPE provided, that that there's an increase in pay for the providers to ensure that continuity in the workforce. $100 billion for education, and this is in addition to the $1 trillion in general assistance for state and local governments. It addresses the issue of dependents over 17 receiving economic impact payments. It clarifies that issue related to emergency paid and sick and family leave, just making it codified in law, and includes money for Developmental Disabilities Act activities. So From here, it's unclear what the path is in terms of the next large relief package. But what we're going to continue to be doing is hearing from you and from others throughout the country, throughout the autism community, in terms of what the challenges that you're experiencing are, what we can do to help move the ball forward in Washington, D.C. On behalf of you all. So anyway, with that, Judith, I will turn it back over to you and Kelly and see if there's any questions that I can help answer.
Dave, no federal questions. We have one that I'll save for after Judith's presentation because it's more of a state and local related question.
I had a question I just wanted to mention, I wanted to ask Dave. So in terms of when you limit the access to an individual who's in a hospital setting clinic, are those conserved people? Are those people that have conservatorships? The conservator is still not allowed to be in the room or be part of the treatment plan for that individual? Does anybody, I mean, if a person is conserved, are you able to enter and be with that person?
So I will turn it over to Judith in a second, who's really been following this so closely and been hearing from a lot of families directly. I think the one comment I will make is that this just varies. Like, I mean, the problem is that there are some states that have issued guidance, which is great, to hospitals to tell them, here's what you should be doing. But even within those states, from hospital to hospital, they may not be following that. And so there's a lot of inconsistency, even in places where there's been a policy established. But Judith, I will turn it over.
Okay.
It's a really valid question and a concern, and we definitely have heard from families where there is a conservator or guardian type situation and they were not able to be with the patient because of the whole situation with COVID-19. And so with our population, that's such a concern. There are safety issues, there are communication barriers, you know, it's just a really difficult situation. And so we're advocating around that. As Dave mentioned, we have a statement, you know, that we've put out around that too. So if you've experienced that, anyone that's part of the webinar today, please let us know. It's something that we're tracking and we're trying to find solutions for because we want to make sure that our population has appropriate medical care.
Mm-hmm.
Okay. All right. Who's ready to talk about state advocacy? Are your brains full from all the federal stuff? Yes. All right. Yay. Okay. So there are many issues, excuse me, that we're facing on the federal and state level that affect our community. Based on the things we're hearing from our community, we've kind of focused on healthcare, home and community-based services. Many folks refer to that as HCBS, special education and early intervention. Those are kind of the big buckets that our community pulls from during typical times and particularly during times of crisis. So just very quickly, for those who access their health care through Medicaid, there's a waiver that CMS made available. Well, it's always been available during times of federal emergencies, but CMS early on let the states know that they would be approving 1135 emergency waivers, which is really targeted for people who use Medicaid for their health care. So if you go to the pediatrician and you use Medicaid as your insurance, this would affect that. So things like that sort of access. So they have temporarily suspended Medicaid fee-for-service prior authorization requirements, and they've extended pre-existing authorizations. They have suspended pre-admission screening and annual resident review requirements or assessments for 30 days. And they've modified some of the provider enrollment provisions. And if you really want to geek out on the details around this and what it looks like specifically for Arizona, there is a link here that we'll be sending out with materials that we provide after the webinar. But basically, it's kind of all about flexibility. They want to make sure that people who use Medicaid as their health care plan, that it's more flexible during this time. There has been a big shift nationwide to telehealth during the pandemic, and states have been given a lot of flexibility around that, particularly in the Medicaid plans. Federal approval wasn't even really required for Medicaid plans to be able to just implement telehealth coverage when this all started. In Arizona, Governor Ducey did issue an executive order early on requiring the coverage of telehealth services in the insurance plans and also in the Medicaid plans. And as part of the Medicaid plans, the AHCCS response, they addressed it directly and say that it covers all forms of telehealth services moving forward during the public health emergency. And again, if you want to read the fine print, which I'm sure some people want to do, there's a link on this page that you can read that on the AHCCS website specifically. What does this mean for our community if we're talking about, you know, Medicaid or private health insurance that's state regulated? What kind of services can we expect to be covered through telehealth? I mentioned the pediatrician visits or the primary care physician visits, but also those therapeutic and behavioral services, behavioral health treatments like applied behavior analysis, therapeutic services that are so important like speech, OT, PT, and then of course the psychological and psychiatric care that our community depends on. Those are all being provided or should be provided via telehealth. And if you're not able to access, we definitely would want to hear from you about that. Okay, moving quickly along, I'm going to shift now a little bit to HCBS, those home and community-based services that are provided in the waivers in Arizona, those Medicaid waivers that the Arizona Healthcare Cost Containment System, AHCCS, provides or oversees for you. There's this mechanism that was provided early on during the time of pandemic called Appendix K. And I had never heard of Appendix K prior to this pandemic, but it has been something that state Medicaid agencies could use during a time of an emergency like this. And again, it allows waiver services to be provided in a more flexible way. Arizona was on it and they applied for an Appendix K flexibility and they were approved on April 6th of 2020. And so for those of you who get Medicaid waiver services through Arizona, you're going to see some flexibilities. It allows providers to provide services in alternative settings. And keep in mind, this is waiver-wide. The Appendix K application for Arizona was for all the waivers that affect our community. You can modify person-centered plan development, the process, so that's going to be more flexible. It allows for services in acute care hospitals or short-term institutional stays, supports and services there. Something that I hope is being helpful is providing retainer services to providers so that they can stay afloat during this time. And it also allows or expands the opportunity for legally responsible individuals, parents and spouses, to be paid for direct care services that normally are paid to direct service providers. So that's been important to families who are stuck at home and they're not able to go into the community to access services. To be able to be paid to provide those services during this time is very important and helpful. Again, there are links if you want to read the fine print around it. Of course, you can always let us know if you have questions too. But if you see the bottom of the slide, there are links to the actual Appendix K application. You can read it. I promise it's not too painful. It's actually pretty logical. And then you can also go to the Department of Developmental Disabilities website and just read about specifics there. They've been fairly good about updating information that should be affecting you. Okay, deep breath. Let's talk about special education and early intervention and what that experience has been like for our community. We know it's been challenging. It's very difficult for much of our community to access remote learning in a meaningful way. There is a Q&A on the Exceptional Student Services website that answers all sorts of questions about remote learning and special education and kind of what they're thinking. And that's being updated fairly regularly. So if you go to the link, the most current version of that is available to you, and I would encourage you to take a look at it. There was an email sent out to school leaders by Kathy Hoffman May 20th, so not last week, but week before, I think that's right. And it basically says that the buildings can begin to reopen June 1st, and they're really looking to the local schools to decide how to do that safely. And they're considering what they need to do for PPE and social distancing and all those protocols. You can find more information about that at the link as well. I think it's always hard for our community when state agencies and leadership says, you know, this is going to be decided, you know, on the district level or in your community, you know, because there's such disparity about the way services are delivered. I would encourage you, if you're able, to engage with your local school district about safety protocols for your student. We are actually hearing from many families that they're anxious for those in-person services, but there's that fine balance of accessing in-person services while remaining safe and healthy. And so express those needs to your local school district. If you can get involved, please get involved with the conversations. And we definitely want to keep hearing from you about how this is all playing out. There is specific advocacy that we're doing that we hope will affect this in a positive way. Dave mentioned earlier that part of the federal legislation that was passed included money for education. It's just shocking to me actually right now to hear about the trillions of dollars that are floating down from heaven above in DC that hopefully are getting to our communities. There is a portion that's dedicated to education. Arizona received a chunk of that money. You can see here that the K through 12 allocation is $305 million that came through the COVID-3 CARES Act as part of that Education Stabilization Fund. Post-secondary in Arizona got $406.2 million. And then there's this pot of money for Governor Ducey, the governor's discretionary fund, or it's also being referred to as the GEAR Fund, $70 million that the governor has to direct towards education. And so we're advocating that the governor concentrate on some things specific to our population that we hope will address really important areas of need. One is around just access, hardware, software, Wi-Fi. Do you live in a community that has access to that? Do our families have the right kind of equipment to be able to access remote learning or telehealth, you know, through an iPad or a computer? What does the Wi-Fi look like? So that's important. We're very concerned about little ones who are in early intervention aging into special education and what that process looks like. In some states, we are seeing action from the early intervention agencies saying that they're just going to hit pause and allow the little ones to continue to engage or access early intervention services, and they won't be pushed into special education until things normalize around delivery of special education, if it's appropriate for that individual child. So we think that makes sense. You know, if a child has lost services during this time, telehealth delivery of early intervention is challenging. If they need to be in early intervention a little bit longer, we want them to be able to stay there if they need to. We're very concerned about the services that our students are not accessing right now. Even if everyone's doing the very best they can from a general education or special education perspective, our students are not accessing a free and appropriate public education. We know that. There's lots of talk about compensatory services down the road. What we would like to see is, as soon as possible, meaningful services right now over the summer, in person if it's safe and appropriate and needed for your individual student. We'd like to see those possibilities explored and made available by using some of this funding that's already come down from the federal government. And then coming back to transition again, we talked about transitioning into special education. Well, we're very worried about the students who are transitioning out of special education. If you're at the end of your journey or coming into the end of your journey around special ed, going into the adult world, there are processes and conversations and assessments that need to occur. And we don't want any student to forego that just because of COVID-19. So if we can hit the brakes there or find a way to allow those services to be delivered, even after a student exceeds the age of eligibility, we'd like to see that happen, and we'd like to see some of the governor's discretionary funds be used to support those needs. So those are the advocacy priorities that we've set on a state level, and how we'd like to see the governor's funds allocated. So in order to stay engaged with us, we know there are many great autism organizations in existence in Arizona that are doing God's work. We know that we love to collaborate with them and with individuals. We get so much more done when we all work together. So please stay in touch with us, and we'll keep you updated about the work that we're doing. You can follow us on Facebook. You can follow us on Twitter. Although I think Twitter's a nice thing to avoid these days, but that's just me. But follow us on Twitter if you're a Twitter person. You can follow us on Instagram too. So my daughter says I'm an Instagramma because I'm so old and I don't know how to use Twitter or Instagram. But if you're young and cool, I think Instagram is one of the places you can be. So we're there. And then if you don't like any of that stuff, if you're not a social media person, we've got a good old-fashioned website, and you can go to autismspeaksadvocacy.org, autismspeaks.org/advocacy, and we post news constantly there too. You can also email us at advocacy@autismspeaks.org. I feel like we're just giving you so much information, but I hope it's helpful. And I'm going to take a breath and stop talking and see if we have questions.
We do. We have a couple good questions. The first one has to do with IEPs, or individualized education plans. Are schools or IEP teams required to meet a standard of services while schools are closed?
They are, and they're actually addressed. If you go to that Q&A that's on the Exceptional Students website, they do address that in the Q&A. They do, kind of intentionally remain vague, but it's important to note that a free and appropriate public education is required right now if schools are in session, and families should definitely pursue that.
Okay, thanks, Judith. And the other one, I think an element of this got answered by Emily in writing about how our autism response team might be able to help. But for you, Judith, you may have some additional thoughts. As mentioned, Arizona does not have a stated policy that allows support staff, relatives, guardians to accompany people with autism and IDD when they receive COVID-19 treatment in hospitals. This individual, Phil, has contacted the Department of Health, the Developmental Disabilities Department, the governor's office, state legislators about, advocating for such a policy with no response, and is asking what he should do next, because as his son's guardian, he wants to be as prepared as possible to make the case to be allowed to stay with him if he's admitted.
So, Bill, I would say, if you don't mind, I'm going to put my email address in the chat. If you would email me directly, and let's talk about meaningful ways to advocate, because your concern is the concern of many. So let's put our heads together, since you've already been working on this, and see what more we can do to move forward with the conversation around that.
Great.
Okay.
Thank you. That is all for now.
Okay, wonderful. Okay, everybody, stay with us. This is the really good part. We want to talk with you. Marianne has really great information to share about supports and services Autism Speaks is providing right now during the pandemic. So, Marianne Sullivan.
Okay. Hi, everyone. Thank you for being here, taking some time out of your day. Although I know it's very hot in Arizona, so hopefully you're in a cool place with lots of good air conditioning and some shade. But welcome, and again, thank you for participating. When we look at this slide, this is information and resources, and I think Judith opened the webinar with talking about those disruptions in services and how hard it's been on families. And, each day we see that and we talk to folks. Emily is on the call as well, and she heads up the autism response team, and we check in weekly and hear a little bit more about, you know, what's going on with families, how can we help. So it's really important for you to be for you to tell us what your needs are. That goes for service providers as well as individuals, because that helps us to formulate plans and get resources and tools together that are going to be valuable to you. And certainly, first and foremost, the autism response team, which is a group of individuals very well trained in what they do. And essentially they do emails and phone calls all day long to families. So you can call or you can email and talk to someone, and it can be something as bad as you're having a bad day versus your child's having a bad day. We know that there's lots of students out there that require one-to-one in a classroom setting. And of course they're at home, and you know, it's very, very difficult for parents to provide that kind of level of support. Hold on. Sorry, I have a little home disruption, but that's how it goes. Did you need something? Okay. Anyway, let me finish up here. So the autism response team is there for everyone. There's a great, you know, on our webpage, www.autismspeaks.org, there are, constantly updated good information that is available. So I think Judith is going to send these slides out, and that, you know, of course, those links are live and you can click through them. But again, reach out to us, let us know what's going on, how we can help. The smallest request or the biggest request, we'll work through it. Other information, anybody wants, Emily, I think you're on the call. Don't mean to put you on the spot, but I was just curious.
I'm here. Yeah, no worries, Marianne. Hi, everybody. Yeah, I do just want to echo everything that Marianne has said. You know, we have a team that's available to answer any questions. We've been, you know, kind of working on the fly during this whole thing to come up with the resources and the information to, you know, meet people's needs right now. So please do reach out if you do have any questions or you want help with a particular issue.
The other thing I want to make a case for, the outreach team is part of services and support. We now, we do webinars all day long. We'd love to do webinars all day long. If there's an agency or a school or a business that wants to know and learn more about Autism Speaks, certainly reach out to us. You can do that through that help@autismspeaks.org. We've got these webinars down in terms of, you know, a nice 45 minutes and Q&A. I think the families really value it, and just getting the information. It's nice to be together and kind of talk through some of these tough stuff, the difficult times that we're having, because as everyone says, we're more powerful together, and it does make a difference.
Definitely. Definitely. Thank you, Marianne. All right. I just wanted to also let you know just quickly on this last slide, if you go to our website, Marianne mentioned this before, there's a wealth of information. It is also provided by topic. So if you need to do financial planning, if you actually have money, I always laugh at this because most of us are broke if we have a child with autism, but if you need to do some financial planning, there's information around that. Safety, wandering, there's so many resources there. Health and wellness is important. Behavioral challenges is something that's critical for our community. There's just a wealth of information by topic too. So we're doing everything we can to make this information accessible to all parts of our community. Okay, so now it's time to say thank you. I know this has been a lot of information sent your way today, lots of words, lots of talking. Thank you for taking time to engage. If you do have questions, please do stay in touch with us, and we will be in touch with you. We're going to send out this webinar with the links, and we'll also have a recording if you prefer just to watch it again. But I hope that you all stay safe, stay well, and get through this time, and just know that we're here to advocate with you. And we will talk again very soon. Thanks for joining us today.
Thank you.